Good morning everyone. So myself Dr. LAKSHMI Devi. My paper presentation is regarding the comparison of the surgical induced astigmatism in superior versus temporal incision. So as we all know, the most commonly performed surgery is the cataract. There are several innovations in the field of the cataract surgery, but because of the financial constraints, most of the surgeons will follow the conventional methods like manual small incision cataract surgery. To achieve a supernormal vision in a manual 6, astigmatism is the significant barrier. So the main factors which is responsible for the astigmatism is, one thing is constriction of the self-sealing tunnel and manipulation of the nucleus. Another important one is the site of the incision. So my study is regarding the site of the incision, which is a prospective based study. I have included 150 patients in this study, and I have splitted the 150 patients into two groups, 75 in each group. Group A, which is a superior incision, and Group B, I have assigned the 75 patients to the temporal incision considering the preoperative astigmatism. So I have included all the grades of the cataract, right from the immature to the mature grade 4 with the normal corneas, and the age groups are 50 to 80 years. I have taken the participants who have given the consent for my study. And the thing, I have excluded all the complicated cases like who have preoperatively astigmatism, corneal disorders, glaucoma, raised IOP, traumatic cataract. So I have excluded all the complicated cases. And the thing is, the surgical procedures, all the surgeries have done by a single surgeon, by my professor, and under the periverbal anesthesia with the superior and the temporal incision. Almost all the surgical steps are similar for both the incisions. The only thing is position is different with the superior as well as the temporal incision. And the thing is, postoperatively I have taken the keratometric values with the help of an automated keratometry in the day first week and also on the 6th week, followed with the statistical analysis with the help of a statistician and the unpaid t-test. My results are like this, and the age distribution, mean age group in my study is 56 to 60 years, and sex distribution, females are more in my study. Coming to the distribution of the sample by the diagnosis, almost the immature and the mature cataracts I have distributed equally to the both the groups. Then followed by the comparison of the preoperative and the postoperative visual acuity. So in this table, we all know that the better visual acuity, that is almost more than 612, 69, 66, are better with the temporal incision than comparing to the superior incision. And this is the visual acuity at the 6th week. The better is more with the temporal incision. Coming to the type of the postoperative astigmatism, which is taken at the 6th week, that is 42 days after the surgery, there is a with the rule shift with the temporal incision, and there is an against the rule shift which is seen with the temporal incision, superior incision. Then this is the postoperative astigmatic pattern. So we all know that the lesser astigmatic diopter is seen with the temporal incision, and higher astigmatic dioptric power is seen with the superior incision. So this is my mean values which came out significant, which is P is less than 0.1, and my SIA mean values has supported with other studies which has taken right from 1998 to recent 2022. And so my conclusion is, preoperative astigmatism considering is the important factor, because if the patient is having a with the rule, we have to go for a superior incision. If the patient will have an against the rule, we have to go for a temporal incision. And another two important beneficiaries which is coming from the temporal incision is, one thing, the against the rule is which is more commonly seen with the elderly age groups, and also if the patient in the elderly age groups have a deeper sockets, which has a beneficial with the temporal incision. These are all the references I have taken for my study. Thank you.